I think we'll go ahead and get started with today's session. Thanks for joining us. I want to welcome you and thank you for joining today's webinar. My name is Jeff Jensen. I'm from the Graduate School of Social Work at the University of Denver. And in today's webinar, we want to introduce you to 4 behavioral health prevention training modules that have been developed as part of the Ensure Healthy Development for Youth Social Work Grand Challenge. As shown on this next slide, the session will begin with a brief description of our Grand Challenge, Ensure Healthy Development for Youth, along with the parallel work that we do under the organizational entity Coalition for the Promotion of Behavioral Health, and I will be leading that session. We will then describe and show examples from 2 of the Coalition's behavioral health prevention training modules. This lies at kind of the heart of this webinar, really. And in this segment, in these segments, Ann Williford from Colorado State University will be presenting examples from our first module, what we call the key concepts and prevention of theory module. And Elizabeth Anthony will follow with examples from the community practice module. Elizabeth's from Arizona State University. We will have some time, we think, for questions and discussion. And with regard to that, it would be best for us if you could submit questions via the chat function, and we'll track that and try to get to some of those questions after the more formal part of the presentations. I want to thank Kira Silk from the Grand Challenges Initiative and all the folks at the Grand Challenges for Social Work for helping us arrange this session. And Kira will be following along with us and monitoring the chat function and advancing the slides and doing everything for us today. So thanks, Kira. I really appreciate you doing this. So with that, I think we're ready to get started. I want to set a little bit of context prior to getting to the specific modules and the examples from the modules. And just to note that this work was developed under the Grand Challenges for Social Work initiative, which was an initiative that was created by the American Academy of Social Work and Social Welfare 5 or so years ago. It was designed to be an initiative that looked at big picture and social problems and tried to integrate the use of evidence and science in combating social problems. And as you see on this slide, there are 13 Grand Challenges for Social Work. We're representing the Ensure Healthy Development for Youth Grand Challenge. The original co-leads for this Grand Challenge were myself and David Hawkins from the University of Washington. And we've recently turned the lead over in the past 6 or 7 months, to Valerie Shapiro, who's at the University of California, Berkeley, Kim Bender at the University of Denver, and Melissa Lippold, who's at the University of North Carolina, Chapel Hill. And as you'll hear from me, we have a coalition that's a number of people who have been active in the products you'll see today and other things that we've done in the Grand Challenge, including Ann and Elizabeth, who have been important players for us. Next slide, please. So when we began this work in the Grand Challenge, we really started with a pretty fundamental question, and that was what are the best ways, what are the best strategies to promote the healthy development of young people? Next. And we landed quickly on the importance of prevention as a key strategy in promoting youth development. And we developed a framework called Unleashing the Power of Prevention. It also became kind of a talking point for us. And as we went and talked to states and communities and practitioners and policymakers, we really began to unroll this idea. It was time to unleash the power of prevention. And what we meant by that was really, it was time to use evidence from prevention to try to have a bigger role in practice and in policy. Next, Drew. We now know from controlled trials that have been conducted in the past several decades that there are more than 80 effective programs and policies out there that effectively prevent behavioral health problems in young people. A good place to learn about these effective programs is the University of Colorado at Boulder's Blueprints for Healthy Youth Development program and Blueprints Registry. It's shown here on this slide. Blueprints has identified some 15 model, or what they call Model Plus programs that reach the highest levels of rigor, scientific rigor in showing outcomes, and 66 promising programs. And great information is available on the Blueprints website about all of these programs. It's a great source for you to learn more about tested and effective prevention programs. We also know there are effective policies, particularly those aimed at preventing smoking, drinking, other drug use in young people. And I would refer you to the Surgeon General's report of 2016 as a very good source for learning more about effective policies. Finally, we know that prevention saves money. The Washington State Institute for Public Policy, for example, has conducted a number of benefit cost analyses showing that tested and effective programs are also far less costly than treatment alternatives or than, say, justice-oriented alternatives. Next. So we can say now with confidence, really, that all these behavioral health problems that are showing on the screen have been prevented in controlled trials. So, and this runs quite a range of behaviors. So mental health problems, symptoms like anxiety and depression are included in this. Substance use, delinquent, aggressive, and violent conduct or behavior, forms of risk, other forms of risk-taking, risky driving, risky sexual behavior, self-inflicted injury, and school-related outcomes. So all of these have been prevented now in controlled trials. Next. Despite the progress we've made, and despite this body of evidence we now have, we also know that many of the most effective interventions for preventing behavioral health problems are still not being widely used across the country, and this is the sticking point and the focus of a lot of our work. We also know that we continue as a nation to invest much less in prevention than we do in treatment or in law enforcement. Next. And to the latter point, this is a slide that shows federal drug control spending for fiscal years 2008 to 2017. And you can see quickly where prevention lands in terms of its comparing to levels of funding for treatment and law enforcement. Prevention spending in the country is shown in the blue bar, treatment in the brown or orange bar, and law enforcement in black. And you can see that there's a small amount of dollars that go every year, each fiscal year, for federal spending, in this case, in drug prevention, relative to treatment and to law enforcement. You can see that funding started to increase each year for treatment beginning in 2013, but not so for prevention. Next. So the Ensure Healthy Development for Youth Grand Challenge has had really two 10-year primary outcome goals. And we created the Coalition for the Promotion of Behavioral Health as the organizational entity to advance these two primary outcomes. And these outcomes are first to reduce the rates of behavioral health problems in young people from birth to age 24 by 20% in a decade. And secondly, to reduce racial and socioeconomic disparities in behavioral health problems by 20%. So ambitious goals, but we felt reachable. We wrote a framework, a paper. It's called Unleashing the Power of Prevention. I alluded to this earlier. That really included a framework for action, which I'll show you briefly in just a minute. This was this paper became, and the framework has become the guiding source of all the activities really in the Ensure Healthy Development for Youth Grand Challenge and in the coalition. And it was published almost simultaneously by the National Academy of Medicine and then by the Grand Challenges initiative itself when initial Grand Challenges were selected. Next, girl. Unleashing the Power of Prevention includes 7 action steps, and we've also written a strategic plan that parallels or dovetails these 7 action steps in more detail. These action steps have been the basis from which we've gone out to work with communities and states in particular. And you'll note here that they vary. So one of the first action step was about increasing public awareness of the effectiveness of prevention. We found historically that people really don't understand prevention all that well, and that as a result, this lack of understanding or awareness, frankly, leads to its lack of funding. So we have action steps devoted to increasing public funding, to helping create the capacity really to implement tools to help communities assess the most salient risk and protective factors in their communities, and then to select evidence-based prevention programs and policies that target those factors. To this effect, we've been advocates of several prevention systems in the country, Communities That Care most notably, and also the Prosper prevention system. Other action steps include establishing criteria for preventive interventions, increasing infrastructure to support the implementation of preventive interventions. In this regard, we've been working with several states to help states' offices of behavioral health and public health to develop statewide prevention plans and to try and stay involved at levels of implementation of those plans. 6, monitor and increase access to effective preventive interventions. And 7, which is the focus of the rest of this webinar, create workforce development strategies for new roles in promotion and preventive interventions. Next slide, Carol. Thanks. So to meet the workforce goal or action step, or what we're doing under this action step really, and to meet this goal, we've done several things in the past 5 years. We've been advocating for increased training in prevention practice and policy across the social work educational continuum and also in other disciplines. I'll mention that in a moment. We've developed and disseminated prevention training modules, which is the focus of today's session, for use in social work and in other and by other disciplines as well, including prevention science, public health, family studies, and so forth. And we've been working with some of our national organizations to try and increase exposure to these awareness, really, of these prevention training modules. Next. The coalition then has developed 4 training modules for use in the classroom or in other settings, frankly. We're talking mostly about classroom application today. The modules shown here include content on prevention theory and key concepts, the first one. Direct practice in prevention, the second. Third is community prevention practice. And finally, a module on policy prevention practice. Each module is free and can be downloaded and reviewed and downloaded at our website, at the Coalition's website, which is shown at the bottom of this slide. So I encourage you to go there, download these modules, look at how they may be applicable to the teaching that you're doing or presenting that you're doing, and let us know how it goes. We're very interested in learning how the modules are working out there for people. A little bit more about these modules. And Ann and and in Elizabeth's demonstrations will show you this more clearly. But just as an overview, the modules can be taught as standalone sessions. You can use them as is, or they can be easily adapted and infused into existing courses. So in social work, that could really be foundation or advanced courses in the MSW curriculum, for example. And per social work, the modules, each module was matched with the 2015 EPAS competencies as part of a really kind of a systematic effort to increase the relevancy for social work education in particular. But having said that, I do want to emphasize the modules are also appropriate in other disciplines, and indeed some other faculty in other disciplines have been using these in part. So departments like family studies, human development, public health, psychology, etc., certainly would find that they're also equally appropriate in their disciplines. The modules are designed to be taught in 1 to 3 hour segments. Again, if you look at these, you'll see some of the particulars, and you'll see a couple examples here in a few minutes. The 4 modules are also connected via case studies. So there's a case study that runs, 1 or 2 that run across all of the modules, you might say. You'll get a glimpse of this, I think, in Elizabeth's presentation in particular today. And as far as sequencing the modules, we believe the best format there is to introduce students to the first module, which is the key concepts and theory piece. Anne will be demonstrating some of this in just a moment. And then direct practice, community practice, policy, really in any order. There isn't necessarily an order that has to be followed here in using these modules. The content is interactive. Embedded in each of the modules are mini lectures, activities, video clips, scenarios, discussion questions, issues of social equity, wellness, community collaboration are among the other topics that are kind of embedded across all 4 of the modules, and there's probably others I'm not mentioning. Several of the modules also contain content, activities, and links to effective and well-known prevention programs. So for example, in Module 2, a session from Life Skills Training, one of our most widely tested and implemented school-based programs in the country, developed by Gil Botvin, who's a member of our steering committee coalition, steering committee on the coalition. That's is included in this direct practice module. And examples from the Communities That Care prevention system developed by David Hawkins and Rick Catalano, also members of our steering committee, and other members at the Social Development Research Group at the University of Washington are found in the community prevention practice module. So we've tried to create links that bring these programs basically to life for students and for participants, and they see how they work. So just a couple more words, and I'm going to turn it over to Anne and Elizabeth. The goals of these modules really then are kind of, there's probably threefold. So we really want to increase, first, we want to increase students' interest in prevention, in the power of prevention, and by that the evidence and the importance and the impact of prevention. Second, we want to encourage students to consider careers in prevention practice or policy. We know now that many MSW graduates in social work go on to work in behavioral health settings these days. And we think it's really important that students in these settings are well-versed and well-trained in prevention, and that they use these prevention principles and knowledge of prevention over the course of their careers. And finally, a related goal is really to increase the content about prevention, effective prevention programs and policies in our own discipline, social work, and in other disciplines. It seems there's been kind of a lapse, I think, in some of our training in regard to the amount of attention given to prevention by our field, and this is something we'd like to see increased. Next slide, Kira. So with that, we're going to move to showing two presentations from Ann. First, from Ann Williford, will present and try to illustrate, and will illustrate examples from the prevention theory and concepts modules. This is the first module in those four. I showed up on one of the last slides. And then following Ann, Elizabeth Anthony from Arizona State will describe and illustrate examples from the community prevention practice module. And Kira's dog is going to help with some of this, I think, as it goes along. Just kidding. Okay, well, thanks for that. And please submit any questions as you go along via the chat. We'll try to get to some of these at the end of the session. So I'm going to turn this to Ann.
Good afternoon. My name is Ann Williford, and I will be talking today about how to bring prevention science into the classroom by covering our prevention theory and concepts module. With this presentation today, I intend to illustrate how information from the theory module can be used as a standalone unit or in combination with other modules, as this module seeks to describe prevention, how it's applied in practice, and as such serves as key foundational knowledge for students. Out of this particular module, students should be able to, at the end, explain what prevention is, including its 3 levels, describe the concepts of risk and protection, identify risk and protective factors through assessment, describe how the social development strategy can reduce risk and enhance protection, and identify empirically supported strategies to promote the behavioral health of young people. So why prevention? Some students may be familiar with this story, but it really helps to set the stage as to why upstream efforts are critical. Not that we can ignore the need for downstream intervention, but that there is value in preventing negative outcomes altogether, or at a minimum, keeping them from worsening with intentional prevention efforts. So, upstream, downstream. It was many years ago that villagers in downstream recall spotting the first body in the water. Some old-timers remember the poor facilities and procedures for managing the rescue. Sometimes they say it would take hours just to pull 10 people from the river, and even then only a few would survive. The number of victims in the river has increased greatly in recent years, and the good folks of downstream have responded admirably to the challenge. Their rescue system is clearly second to none. Now, most people discovered in the swirling waters are reached within 20 minutes, many in less than 10. Only a small number drown each day before help arrives. This is a big improvement over the way it used to be. Talk to the people of downstream and they'll speak with pride about the new hospital by the edge of the waters, the flotilla of rescue boats ready for service at a moment's notice, comprehensive plans for coordinating all the manpower involved, and the large number of highly trained and dedicated swimmers always ready to risk their lives to save victims from the raging currents. Sure, it costs a lot, say the downstreamers. What else can decent people do except provide whatever help and support is necessary when human lives are at stake? A few people in downstream have raised the questions now and again. What is happening upstream? How are these people getting in the river? Why do so many of them not know how to swim? But most folks show little interest in finding the answers. It seems there's so much to do to help those already in the water that nobody has the time to check on how these people are getting in the river in the first place. That's just the way things are in society sometimes. So with this particular story, I then move into processing what is going on in the downstream, upstream communities. And there's a series of questions that can be helpful in this processing. Number one, getting students to really begin to consider, why are we focusing so much on the downstream efforts when we could be focusing upstream? So why are people falling in the river upstream? Why are people falling in and drowning? Why do so many people not know how to swim? What actions are preventative and what actions are reactive? And I think this is really a critical question. Why might the downstream community be hesitant to partner on an upstream approach? Because we certainly know that that can be a barrier sometimes in prevention in comparison to intervention. So from here, I typically revisit the upstream-downstream story, prompting students to consider how different levels of prevention could be applied to the problem. For the universal, I will ask, for example, of the actions we discussed earlier, which might be considered universal prevention? Are there other universal prevention strategies you can think of that would keep all or most people from falling in the river? So universal prevention activities seek to prevent a problem before it's happened. This is the aim to address everyone in the population, although we are rarely successful in preventing problems uniformly. For the selected interventions, we seek to prevent a problem among a group of people that have been identified as particularly at risk for the problem. So in going back to the upstream-downstream conversation, I then ask students, who do you think might be most at risk for falling in the river? What extra actions could be taken to protect this group? And then lastly, in indicated prevention, we seek to prevent problems for a group of people who are already showing signs that they have early stages of the problem. So again, going back to this story, I asked students to say, people who just started down the river clearly have a problem, but they have not hit the rapids or started to struggle. What actions could be taken to help this group avoid making the entire trip down the river, hitting rough waters, and potentially drowning? Once they wrap their head around these three levels of prevention using the upstream-downstream story, I then transition to asking students to focus on issues in social work they are passionate about and try to apply different levels of prevention, whether that be crime and violence, suicide risk, addiction, substance use issues, really anything that they're worried about in terms of youth these days. From here, they can begin to understand that even in youth-serving systems that focus mostly on intervention, like when we're thinking of child welfare or juvenile justice, applying prevention practices is still possible and may help to lessen the challenges youth and their families encounter. So what is the social development strategy? The social development strategy helps students to understand how risk and protective factors can be targeted to prevent problems from starting in the first place or stop them from worsening over time. There is an excellent 6-minute video embedded in this module that can be used to illustrate the elements of the social development strategy. Briefly here, the strategy prioritizes how developmentally appropriate opportunities can promote meaningful connections to others, especially when youth have the skills and receive the recognition for these positive interactions. As a result, they are more likely to create a sense of attachment, emotional connection, and commitment to the people and groups who provide that recognition. And as a result, they become more motivated to adopt norms and behaviors of those to whom the youth is bonded. This is a useful strategy to help students understand that there are particular avenues toward promoting positive youth development, and that it really depends upon the ways in which we are working with youth in their sense of belonging and attachment in their social environment. After introducing the social development strategy, I then move on to talking more specifically about the risk and protective factor framework. Risk factors can be defined as characteristics of an individual, peer group, family, school, or community that makes it more likely that a young person will experience a problem. These factors place a person at an increased risk for a particular problem. On the other hand, protective factors are characteristics that make it less likely that one will experience a problem, or characteristics that reduce a risk factor's impact. These factors then serve to buffer an individual when faced with risk. Protective factors are also often called assets. From here, it's useful to introduce one of the case studies so students can begin applying their understanding of risk and protective factors to a youth's life. Elizabeth will review one of these case studies in her presentation. Sometimes I will use all 3 case study examples to illustrate different risk and protection profiles. I first process the case scenario by asking students to identify where the social development strategy could be applied. For example, asking them, what is an opportunity that might be helpful to the youth in their story? What existing strengths and assets might be there for the youth to engage in this opportunity? And from there, we then move on to identifying specific risk and protective factors that they see in the case study itself. This is what helps to achieve the one learning outcome related to risk and protective factor assessment. Applying this framework to the case study is certainly a really useful exercise for students to understand how to identify risk and protective factors in a child's life. However, we can't consider this in a vacuum. We can't just look at this at the individual level without considering where we might be experiencing risk at the systemic level. So in order to help students understand how prevention can be applied at all levels and be a critical tool for social justice, I offer them these processing questions. Number one, how can professionals use a risk and protection factor framework in a way that addresses both individual and systemic risk and protective factors? In addition, we need to consider where systemic injustice is occurring. So I asked students to consider what social justice issues could be added to our understanding of risk that are facing particularly marginalized communities. So how can we use this theory module in conjunction with the other modules that have been developed? So while the prevention theory and concepts module can be used as a standalone unit, I oftentimes use this first as a way to provide that kind of foundational understanding of prevention concepts. So what is it? How do we analyze risk and protective factors? And how do we utilize that knowledge to then think about intervention at different levels of practice? So I usually use this particular module as a starting place and then move on to the content that is specific to the course that I'm teaching. For example, when I've taught direct practice courses, I oftentimes will start with the prevention theory and concepts module and then move into what's more specific to direct practice. For example, this particular module connects the case study examples back to the application of evidence-based prevention strategies by, one, requiring students to identify risk and protective factors present in the case study, and then ask them to consider how they intervene at the individual or family level. Within this module, as an example, we walk students through a universal evidence-based prevention program, life skills training. In addition, we've developed a policy practice module. Here we make the case and include practical examples of using the case studies of how prevention is an important element for advancing social justice, especially in our most vulnerable communities where we often see higher levels and concentrations of risk factors. So what we ask students to do in this particular module is think about how we engage in effective policy practice by advocating to different kinds and different levels of legislative bodies, to advance policies that reduce risk and promote protection with the ultimate goal of preventing social problems by alleviating persistent disparities that oftentimes affect our most vulnerable communities. Our last module developed is our community practice module, and that is what Elizabeth will be reviewing here today. Thank you so much, and we look forward to answering your questions.
Good afternoon. My name is Elizabeth Anthony from Arizona State University, and I'm delighted to be able to present to you the Community Prevention Practice module that I helped develop with Dr. Ann Williford. And so she did a great job outlining a lot of the things that I would already talk about. But what I'd like to do is apply this to a teaching setting where we teach about community prevention practice. So I will give you some examples from my own teaching experience, and I look forward to hearing any examples you may have or what this stimulates in your thoughts. So as with all my classes, I begin by identifying the benefits of prevention and how to advocate for prevention. So I find that bachelor students, master's students, and even PhD students often don't readily identify the benefits of prevention or how prevention works in social work practice. And I find this to be particularly important in my area of study, which is with young people who may be involved in multiple systems, including child welfare, juvenile justice, the school system, the behavioral health system. And many times these systems work in silos. And so starting to talk with students about how will we think about working across these individual systems for the betterment of our children. And so how would we address system level barriers that would help us identify coalitions? And how would we think about maybe integrating services that are currently in silos? So we could spend a lot of time on these objectives. I then will begin by describing prevention in community practice settings. So what is the overall aim of prevention in community practice? And what are some of the current prevention practices that we already have? So there are a number of prevention practices working in the school system, for example, that students might be able to identify, but they may be thinking more globally about ways we could begin to develop new prevention strategies. I then review the levels of prevention, and so universal prevention, preventing a problem before it's happened, so very much like preventing school bullying. Selected prevention, so for people who have already been determined as quote unquote at risk for the problem. So young people who may be more likely because of their experience to run into a particular behavioral health problem. And then indicated prevention. So this is for young people who are already showing signs of some behavioral health issue. And so we're trying to prevent further exacerbation of the problem. So a lot of times people think of this as intervention stage, but really what we're trying to do is prevent further issues. And so if we're catching it on the early side, we can maybe prevent a young person from going into a juvenile justice system or into the child welfare system. So then I would move with a child welfare example. And so the agency has experienced another budget cut and is now asked to serve more families with fewer resources. As a result, practitioners are being asked to figure out ways to reduce their caseloads. In an effort to do so, you propose to focus some resources on prevention efforts in the community rather than in more costly intervention services. It is likely to be a paradigm shift for many in this agency. And so students working in child welfare tend to think of it as individual child welfare workers. But when we start to look at it more globally, this is really important. What I love about these modules is we have lots of different case examples. And so I would like to show you the case example of Jessie, which is an application of the community-based prevention practice. So Jessie is a 14-year-old female who identifies as white. She recently moved with her mom, dad, and little sister to Denver's Montbello neighborhood. Montbello was established 50 years ago and has nearly 35,000 residents. Of these, 61% are Hispanic, 24% are Black, and 11% are white. There are an estimated 7,000 families, and over half of the residents are under the age of 35. Although it is the largest neighborhood in Denver, Montbello has experienced historical underinvestment of resources and infrastructure on many fronts. It is also one of Denver's poorest neighborhoods. 25% of residents live in poverty, compared to Metro Denver's overall poverty rate of 12%. The neighborhood has no grocery stores, limited places for community gatherings, inadequate walkable access to transportation, and poor infrastructure for outdoor physical activity. It also has one of the highest crime rates of any Denver neighborhood and has a higher than average dropout rate among high school students. Although many of the families in the neighborhood support one another, Jessie's family isn't close enough with any of their immediate neighbors. Jessie feels uncomfortable in some parts of the neighborhood because it is common for older adolescents to be seen selling drugs or getting into fights on the corner or in the neighborhood park. Just a few blocks down from Jesse's home are apartments where people come and go frequently. Police were called recently to a shooting, but no one was arrested. Like many families in the community, both of Jessie's parents work long hours, leaving her unsupervised after school. Jessie knows her parents care about her, but it seems like they don't really know much about her or how she spends her time. After school, Jessie takes care of her sister, surfing the internet and texting with a boy, Rick, she met at school this year. Last week, Rick came over after school, even though her parents asked her not to or told her not to, and he smoked weed at their house. This made Jessie feel uncomfortable as she worried her parents would smell it when they got home, but it seems like a lot of her peers smoke, so she didn't object. As Jessie is one of many youth in the community struggling and at risk for getting into trouble, many stakeholders want to explore community-level solutions to help youth who are experiencing these risks by developing prevention strategies to support youth and families in their own community. So what I would do with this case example in class then is assign students to different roles, and there may be multiple groups. So some could be the school social worker, some could be child welfare workers, some may be the mental health provider or behavioral health provider, and some would be the juvenile probation officer. And so I would ask them, each of them, to develop an intervention plan to support the case of Jessie, the young girl we just discussed. So each provider then has to develop a goal, outcome, and intervention strategy, which could involve the use of an evidence-based prevention program. Students must work together to eliminate the potential for duplication. Again, back to the issue of agencies working in silos and sometimes duplicating services. They must also understand the role of their system and thus in meeting the needs of the young person and their family. This activity is great, and it can be used across multiple class sessions to help students understand the various aspects of prevention and collaboration. And then finally, I would do a wrap up to reinforce the objectives of the module, and then to reinforce again the value of community prevention. So what can we do before young people are placed in out-of-home care settings or the family is otherwise experiencing risk? What can we do at the community level to really advocate for them? This is a great time to have students think about ways they may approach prevention in their own practice, or more specifically advocate for prevention in their own practice settings. I like to wrap up by talking about how resilience among young people really exists at the community level. And it is the failings of adults and systems when young people are not thriving because we have not provided the adequate support for young people. So how can communities support families to raise their children to thrive, not just survive? And how can we address systemic racism at the community level? So we know, particularly in the current pandemic, that we see systemic racism affecting both the coronavirus and racism. And so how can we help address that at the community level? And then one of my I think is one of the most exciting areas of research right now is how can cultural traditions support children to thrive in their own identities? And so how can we encourage and support communities and their own cultural traditions to support families? And then again, in turn, to support resilience among young people so that they're not just simply looking at how do they help themselves, but how does the whole community come around children to build their own, their resilience that exists naturally within them. So I look forward to discussing this module and some of the others and maybe ideas you may have for using this module in your own teaching practice. Thank you.
I'd like to thank both Anne and Elizabeth for those sessions. I hope they give you an idea a little bit about the content that is included in these in these modules. And again, the best way for you to learn more about them is really to go to the website shown here and review those and download those and spend some time getting to know how they can be used in different classes or in different settings. We had a few questions come across the Q&A. One was pertaining to how these modules can be adapted for criminal justice. Was the example, was the form of the question given. And I think, and I'll let others respond here too. I think, Ann, you might have some thoughts on that. But I think the short answer to that is, while these modules are developed with social work in mind, they're much more far-reaching. So I think you'd find the students in a criminal justice program, much of this content would work almost seamlessly. And we do have, of course, other people in our coalition who are doing research in justice settings in terms of prevention. They may be a resource as well. And I know you maybe had a thought on that on the chat line there. Do you want to add in anything?
Yeah, sure. No, thanks, Jeff. And thanks for everybody for being here today. And it's a pleasure to share this work with you. And I love this question to get us started because absolutely I agree that this content, while we developed it with our own professional landscape in mind, we certainly can see the benefit and the utility of retooling these for a lot of different allied disciplines, and particularly in criminal or juvenile justice. I think this ties in really nicely. A lot of the research that I do is around preventing delinquency and violence among youth. And so many of the examples I do use, even in my social work classes, have to do with thinking about prevention within the context of the juvenile justice setting. And so in particular, I think that case studies really offer a lot of utility for folks who are interested in justice systems. And then the content that may need to be developed would really be specific to any kind of professional or ethical commitments that are specific to your own field. But otherwise, I think the content is very transferable to different disciplines.
Okay, thanks, Ann, for that. Well, we may be waiting for some other questions. I just would encourage, again, people to go to the modules and look carefully at them for fit for their application and what they're teaching. You know, one thing many of us have learned as we've developed prevention courses of our own, and this is still very much a growing thing in social work, I might add, but for those of us who have created prevention classes in the past 5 years, it's been very interesting to see the excitement among students who take these courses. And I think that in our existing curricula, particularly in social work prevention, if you do a search on that in social work curricula, you'll find that it doesn't appear very often. And it's somewhat surprising given the origins of our profession dating back to the earliest social work community organizing days when prevention was a critical aspect of everything we did. So it can be, the idea of infusing prevention content in the curriculum can be approached in different ways. Historically, we know that social work was deeply involved in community organizing and prevention at its outset. This is another way in which to convey to students, I think, the importance and the relevance of prevention over time. And also, I think it's interesting to see students kind of eyes open when they think about, well, take a problem like child abuse. How do we prevent child abuse? Well, there are effective ways. There are programs that can deter problems, really serious, significant problems like that before they occur. And that can certainly be very exciting to people once they are equipped with this evidence and see that things can actually work. So we emphasize that a lot in our training and in these modules. Let's see, are there other questions at this point? Anybody would like to pose? We have a couple minutes.
I just wanted to follow up on what Anne had said earlier. So in response to that question, we used more social work examples, but the content in the modules is not always directly social work specific. And so the case scenarios are more social work specific, but the concepts and many of the examples are relatable to multiple disciplines, not just juvenile justice, but family studies, psychology, any of our allied nursing, education. So any of our allied disciplines that really look at prevention.
Good point. Good point, Elizabeth. Let's see. So I'm not seeing a ton of questions out there, gang. Are there any other thoughts or suggestions, questions that anybody from the participants would like to offer to the presenters today? We'd love to hear your thoughts.
Yeah, I do see one great question from Craig. Thank you for that, about how do we consider this content in the context of the shared risk and protective factor models. And I think that's such a great question that we can't obviously, and I think this is particularly where the case study examples can be helpful, because what we're illustrating in these case examples is that there isn't just one risk factor or one protective factor that may be present, but it's the interaction of those that may be leading this particular case to the risk for multiple problem areas to emerge. So those activities related to the case studies can be really helpful to help students understand that when we're thinking about risk and protective factors, we're not just thinking about that in the context of one problem, but thinking about how, say, for example, if we have, for the case study, Jesse, there were lots of different ways that we could highlight a particular risk factor and why that might be a risk for involvement in the juvenile justice system, other kinds of challenges in relationships that she was experiencing. But that is a great question, Craig.
That's right, Anne. I just saw that question, Craig. Good to see you on here. I don't see you, but good to see you read your question. In the whole literature and evidence on risk and protective factors, we know that many of the same risk and protective factors are associated with a number of behavioral health problems that kids have. So when we say shared risk and protection, we're generally talking about this idea that common risk factors or there are common risk factors, common protective factors that are related to multiple problems: school dropout, drug use, aggression, violence, and so forth. So one thing that we found in the field of prevention in general is that a tested and effective prevention program, say life skills training would be one example that is implemented widely in schools. We can find promising or effective results across different behavioral problems, not just a singular problem. So a program like life skills training may have positive effects on substance use, which is what it was originally created for, but also on other types of behavioral health problems that young people exhibit, such as more delinquent related behavior, for example. So we can often get multiple positive outcomes from one program. And it all begins with understanding what those common risk and protective factors are. And a lot of good work has been done on that through communities that care, the prevention system I alluded to, and that was alluded to it's mentioned in our modules. And states like Utah, Colorado, Washington, Pennsylvania, some others have really taken the idea of shared risk and protective factors and use that very diligently and the funding in choosing the programs they fund and implement and evaluate. So it's a great question, and something that you can get more information on in these modules, particularly that first module, I think, probably, and in related literature that's cited in the modules. Let's see, there's a question on about how the prevention-focused efforts, how can they be infused more into CSWE, Council on Social Work Education, accreditation competencies? Great question. They certainly should be and need to be. My co-presenters may have some ideas on this. We pertaining to the modules, I know we tried to look at the existing social work CSW competencies when we design these, and if you look at the modules, you'll see a little section on that in each module. But it's a bigger question as being posed, and it's the right one. You know, I think there needs to be work from all of us interested in prevention and social work in particular, with CSWE around the importance of prevention principles, prevention theory, prevention practice, and policy in any of the educational accreditation standards that are there. I think we have certainly the evidence to show for the relevance of these being more visibly highlighted and included in accreditation standards. And maybe that's another subgroup that could come out of some of this Grand Challenge work, a subgroup who might be interested in pushing that a bit, because I think it is something that is lacking now. And we all know that accreditation standards to some degree do drive what people are teaching, what schools are doing, what schools are teaching and offering. And so there's a relationship there that is probably ripe for some additional work. Our team is not focused on that. I think it's fair to say at this point, but it would be wonderful to have a group pick that up. Any other thoughts on that, Elizabeth or Anne?
Yes, I do. Lisa, thank you for that great question. And I think different universities and departments have taken different approaches to this. But one of the strategies we've taken at ASU is to try to develop a prevention course that would cover the basic foundations of prevention. And then we have attempted to develop modules that would be infused into several different classes that would advance the prevention components through some of the case scenarios, for example, that are specific to child welfare or the medical settings or juvenile justice. And so I think schools are taking different approaches, but I think there's room for both. Classes that focus solely on prevention and social work practice, and committees that work to infuse that across the curriculum. But I don't know how you're doing that at Colorado State, Anne.
Yeah, we haven't had as much of a coordinated effort here at Colorado State. Many of us, through our the research that we do, focus on different areas of prevention. So there's many of us that infuse that into our teaching. But again, you know, I think one of the real advantages of doing something like this webinar is to hopefully increase the visibility and the uptake of these modules. And certainly I would love to see that not only within my own institution, but as Jeff was saying, you know, putting some pressure, if you will, on CSWE to consider how prevention is represented in the competencies that we expect practitioners to have as they go into the field. I think that would obviously be a really important way, as Jeff said, to get it to where it's an expectation. And then from that, I think the content and the training would follow.
Great. Let's see, am I missing any questions, Kira? Are there any that you've seen? I think I've been trying to cover most of them, or Anne or Elizabeth. Well, looks like we're at our hour, so I think I will sign off and say thank you so much for being with us today. I know it's a busy week with the world events going on and everything crashing in on us, so I appreciate especially you found time to come online and join us. Please go to the Coalition's website. And I want to thank too the steering committee from the coalition shown on the screen right now. We've had a large, an active group in helping develop all the work that's done in the coalition, particularly, and a particular thanks to Elizabeth and Anne, who have been key authors of this, along with the modules, along with Kim Bender at the University of Denver. So please go to the website, get to learn what we're doing, and please send us thoughts on these modules, how we'd love to hear if you're implementing them and how they're working for you, and what you think we might be able to do a little bit better in terms of content and implementation. Thanks everybody for joining us today. Have a good rest of the day and week. Take care.
Thanks, everyone.
Thank you.